there, health information professionals. Welcome back to the channel. Today, we're diving into some exciting updates for 2024, specifically 5 brand new CPT radiology codes that are ready to make waves in your billing and coding practices. If you're a health professional, medical coder, or just someone curious about the latest updates in medical coding, then you're in the right place. And stay until the end, where I'll share what has been deleted and why. Hi everybody, and welcome back to our channel. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on health information, healthcare compliance, the revenue cycle, and how to become a certified marketable medical coder. In this video, we are addressing new CPT radiology codes for 2024. First, let's highlight some key takeaways to keep in mind. Accuracy is key. When using these codes, ensure precise documentation to the specific procedure performed, the anatomical location, and the type of guidance used. Make sure you're aware of bundled services. Be aware of these bundled services and appropriate use of modifiers to ensure accurate reimbursement. And then stay up to date. Keep an eye out for further updates and guidelines from the AMA and CMS to stay on top of any changes. So let's get right into it. Here's a quick rundown of the new codes and what they're all about. In the radiology, diagnostic radiology, imaging, or heart subsection, a new Category 1 code replaces the 5 deleted Category 3 codes, 0501T through 0504T for coronary fractional flow reserve, or FFR. 75580 non-invasive estimate of coronary fractional flow reserve, FFR, derived from augmentative software analysis of the data set from a coronary computed tomography angiography with interpretation and report by a physician or other qualified healthcare professional. Note that CPT 75580 is classified as augmentative AI, which means that a physician or QHP is required to interpret and report the data. As a reminder, the CPT Appendix S first appeared in 2023 CPT manual and categorizes AI into 3 main hierarchies based on the clinical procedure or service provided to the patient and the work performed by the machine on behalf of the physician or other qualified healthcare professional, or QHP. These AI classifications are as follows. Assistive, the machine works to detect only clinical relevant data. A physician or other QHP must interpret the data and report the results. Augmentative, the machine performs the work and analyzes or quantifies the data in a clinically meaningful way. This category also requires a physician or QHP to interpret and report the data. And autonomous, the machine performs the work, then automatically analyzes the data, interprets the information, and produces clinically relevant conclusions independently without physician or QHP involvement. Also be mindful of the 2 parenthetical phrase guidelines. Use 75580 only once per coronary computed tomography angiogram, and you have when non-invasive estimate of coronary FFR derived from augmentative software analysis of the data set from a coronary computed tomography angiography with interpretation and report by a physician or other qualified healthcare professional is performed on the same day as the coronary computed tomography angiography. Use 75580 in conjunction with 75574. Category 3 codes 0501T through 0504T, which were established in the CPT 2018 code set, have been deleted. These 4 codes were previously used to report non-invasive estimated coronary fractional flow reserve, FFR, derived from coronary computed tomography angiography, CCTA, data using computation, fluid dynamics, physiologic simulation software analysis of functional data to assess the severity of coronary artery disease. Code 75580 has been established to report non-invasive estimate of coronary FFR derived from augmentative software analysis of the data set from a CCTA. Before 2024, these 4 deleted codes describe the components of data preparation and transmission, analysis of fluid dynamics, and simulated maximal coronary hyperemia, generation of estimated FFR model, and anatomical data review in comparison with estimated FFR model to reconcile discordant data. The monitoring and tracking since 2018 have made it evident that the procedural components should be bundled into one Category 1 code and described as augmentative software analysis of the data set from a CCTA. The software analysis is described as augmentative because it provides clinically meaningful output that is predicated on the standard of care for the physician to interpret. Code 75580 includes interpretation and report by a physician or other qualified healthcare professional. A clinical example of 75580 is a 60-year-old female complaining of chest pains after exercising. Previously underwent coronary computed tomographic angiography, or CCTA, that showed coronary artery plaque and lumen narrowing of moderate severity. For example, 60% of the diameter was narrow in the left anterior descending and right coronary arteries. In the diagnostic ultrasound other procedures subsection, cardiac intraoperative ultrasound, or IOUS, 4 new Category 1 codes are now available to report intraoperative ultrasound during cardiothoracic procedures. Those codes are 76984, ultrasound intraoperative thoracic aorta, example epi-aortic diagnostic; 76987, intraoperative epicardial cardiac ultrasound, i.e. echocardiography, for congenital heart disease diagnostic, including placement and manipulation of transducer, image acquisition, interpretation, and report. 76988 is for the placement, manipulation of transducer, and image acquisition only, and 76989 is for interpretation and report only. So those 4 new Category 1 codes are now available to report intraoperative ultrasound during cardiothoracic procedures. Here's a clinical example of 76987. A 5-month-old male with prior repair of tracheoesophageal fistula with subsequent esophageal stricture has a complete atrioventricular, or AV septal, AV canal defect. He is now undergoing repair of the complete AV septal defect. TEE is contraindicated. An intraoperative epicardial ultrasound is performed, the images are interpreted, and a report generated. Clinical example for 76988, a 5-month-old male with prior repair of transesophageal fistula with subsequent esophageal stricture has a complete AV septal, or AV canal defect. He is now undergoing repair of the complete AV septal defect. TEE is contraindicated. An intraoperative epicardial ultrasound is performed. And a clinical example for 76989. A 5-month-old male with prior repair of tracheoesophageal fistula with subsequent esophageal stricture has a complete AV septal, or AV canal defect. He is now undergoing repair of the complete AV septal defect. TEE is contraindicated. The images from an intraoperative epicardial ultrasound are interpreted and a report generated. Got any questions about these new codes? Well, feel free to drop them in the comments below, and we'll do our best to answer them. And remember, we're always here to help you navigate the ever-changing world of medical coding. And as promised, the Diagnostic Radiology Diagnostic Imaging Code in the Gynecological and Obstetrical subsection that was deleted is 74710. To ensure the CPT code set reflects current clinical practice, code 74710, pelvimetry with or without placental localization has been deleted due to low utilization. A parenthetical phrase guideline has been added to indicate the deletion. Staying informed is crucial in the ever-evolving field of medical coding. So was this information helpful for you? If so, consider liking, sharing, and subscribing to my channel for regular updates on medical coding, compliance, health information, and trends in the healthcare industry. Also, feel free to ask any questions or share your ideas in the comment section below. And if you want to know more about medical coding, compliance, the revenue cycle, and healthcare in general, watch one of these videos. Until next time, I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. Remember, be safe, be kind, and don't wish for it, work for it. Thanks so much for watching.